Hi guys, today's video is about lumbar puncture needle. So this is the lumbar puncture needle, and first of all we are gonna discuss about the sequence of layered punctured. The first of all it comes skin, then subcutaneous tissue, supraspinous ligament, interspinous ligament, ligamentum flavum, epidural space, dura mater, arachnoid mater, and subarachnoid space. From the subarachnoid space, CSF is collected. So this is a figure and these are the layers, that is skin. This is the skin, then subcutaneous tissue, supraspinous ligament, and there we have interspinous ligament, epidural space, dura mater, arachnoid mater. And this is the subarachnoid space. Then comes a procedure. A lumbar puncture is also known as spinal tap, is a procedure that involves inserting a needle into the lower back to withdraw CSF or to inject medicines. So the stepwise procedure is you lie on your side with your knees pulled to the chest. The area of your lower back is cleaned and numbed with a local anesthetic agent. A thin hollow needle, that is the lumbar puncture needle, is inserted between the two vertebrae, that is L4 and L5 vertebrae in your lower back, and the needle goes through the dura mater, spinal membrane, and into the spinal canal. The pressure of the CSF is measured and a small amount of the fluid is withdrawn. The needle is removed and the punctured site is covered with a bandage. The anatomical site for lumbar puncture is the interspace between L3, L4 or L4, L5. This is the most preferred site, vertebrae in the lower back. So this is the parts of lumbar puncture needle. It is having a stylet and a needle. So what are the indications of lumbar puncture? The diseases are meningitis, encephalitis, multiple sclerosis, neurosyphilis, subarachnoid hemorrhage, intrathecal administration of certain drugs. Uses, diagnosis of certain diseases. So these are the diseases or infections, or for the treatment, that is chemotherapy, for injecting medications, and for anesthetic purposes, that is spinal anesthesia, for labor and delivery, gynecological procedures, lower limb surgeries, orthopedic surgeries, or groin hernia. So the uses are three, that is the diagnosis of certain diseases or infection, for chemotherapy, and for the anesthetic procedures. After the lumbar puncture procedure, the CSF is collected into 4 containers. So first one is for biochemical analysis, second one is for cell count, the third one for the bacteriological examination, and fourth one is for additional tests. Precautions, it should not be refrigerated. CSF should not be refrigerated. So what are the contraindications? That is infection, an infection at or near the needle insertion site, or bleeding diathesis, that is anticoagulant therapy or other conditions that increases the risk of bleeding. Intracranial pressure, an increased intracranial pressure from a mass, abscess, or other space occupying lesions. Trauma or mass to the lumbar vertebrae. Congenital spine abnormality, a congenital neurological lesion in the lumbosacral region, or unequal pressure between the supratentorial and infratentorial compartments. So that is all about lumbar puncture needle. Thank you.